We begin with the latest research on lockdowns. Early in the coronavirus pandemic, panic sent the U.S. and other societies into a restrictive lockdown mode. But not every country took the same approach. And now, armed with hard data, scientists are addressing the question what worked and what didn't. Bhattacharya is a professor of medicine at Stanford University. He spoke out against lockdowns from the start and is one of the researchers in a recent study that found they didn't help.
So the way that we looked at this is we looked at places, in particular South Korea and Sweden, which in the early days of the epidemic did not put in place mandatory business closures and shelter-in-place orders. And what happened is there's no difference in the rate of spread in the early days of the epidemic if you compare the group of countries that had less restrictive versus more restrictive orders. The lockdowns, the very, very restrictive lockdowns did no better than the less restrictive lockdowns, the less restrictive policies.
Regarding this pandemic, are you concerned about what happens to scientists today or science if for whatever reason they're contrary to what other scientists or the government or the media or politicians want them to say?
Yeah, I think I'm really concerned about that. There's been censorship of people who don't agree with the government or with public health authorities, accusations, false accusations of conflicts of interest. That calls for censorship within science. Anytime someone expresses a view that's contrary to what Dr. Fauci says, they're accused of saying dangerous things. There is an enormous number of scientists, epidemiologists, and other people who don't agree with the orthodoxy of the policy, the lockdown orthodoxy, but we're very uncomfortable saying so for fear of being smeared. I think science is going to have to learn to address that this sort of groupthink mentality and this mentality that attacks outside, because science can't proceed, science can't work unless there is the possibility of open discussion about fear of reprisal.
Bhattacharya helped write a strategy called the Barrington Declaration, which has since been endorsed by thousands of scientists and medical professionals. They call lockdowns a serious health threat and endorse a focused strategy, better protection for the vulnerable, while people at low risk get immunity through natural infection.